Amazing strides are being made in medical technology all over the world. Tallahassee is not the exception. This is the Da Vinci surgical system, now being used by the doctors at North Florida Women's Care. It's named for one of the most versatile, talented men of all time, and for good reason.
Just like anything else, it's a tool that you can keep in your armamentarium. I think most importantly, you can operate with a Da Vinci robot, you can operate with the laparoscope, you can operate straight as an open laparotomy. Any of those cases, you have to tailor the procedure to the patient so that you get the right procedure for the right job.
So how does this amazing technology work?
Da Vinci Robot is a robotical machine that basically operates inside the patient under direct command from the physician. We are looking through a binocular microscope that is passed through the patient's abdomen, and we look around and see all the things that we need to see, and there are two little tiny hands that go in on the inside too. Basically they operate through two fingers on each side, and you open and close and use scissors to cut or a bipolar cautery to seal the blood vessels.
The doctors at North Florida Women's Care are using it for specific surgeries.
You can do hysterectomies, you can do myomectomies, which is removing fibroid tumors from a patient's uterus, leaving the uterus intact for future childbearing. You can also do resection of endometriosis. Now, that being said, certainly you can do it laparoscopically as well, where the operator stands directly over the patient and uses instruments to do the same thing, so that he's making a small incision with what we call minimally invasive surgery, a small telescope that's passed through the patient's belly button, and two small laparoscopic ports that are passed through the abdominal wall as well. All of these things allow us to operate in a position so that we make as minimal incision as possible and get as maximum result as possible.
The word robot may be misleading though, and that the Da Vinci cannot function on its own. The surgeon is in complete control.
The best analogy that I've heard for this is it's like getting something out of the house. Let's say you have to remove a chair from within the house. The best way to do that is open the door, grab the chair, pull it out. Let's say you have to remove a grand piano from the house. You might have to go in through the windows, free up or disassemble the parts of it, and then bring it out through the door that way. And that would be the laparoscopic or minimally invasive procedure. Finally, let's say you have a really big, you have to just resect a whole lot of stuff within the house, a remodeling. You might want to go through the roof to do that, and that would be the thing where we'd make the incision in the abdominal wall.
And while the Da Vinci is amazing technology, and North Florida Women's Care has 4 doctors able to use it during surgery, the doctors will still use the best method and option for each patient as needed or recommended.
You can look at each of these procedures as tailoring it to the given patient's needs. I don't think it's a good idea to do one thing all the time. I think it's a good idea to find somebody who's experienced in whichever procedure that they do, but not somebody who just does one thing and sort of sees the world. If you're a hammer, all the world looks like a nail. For most women, they like the idea of options. And for some reason or another, that plays big. So if you go through a list of options and go through the pros and cons of each one, then the woman will be able to make up her choice. In essence, it's like going shopping, I guess. You can buy what you really want and what works best for you. Some people it's very important that they have a quick turnaround, a quick recovery with low risk of complications. And the important thing is to review all of that with the practitioner who's helping you make your decision, so that you can arrive at a decision that's mutually agreeable.